So early menopause and also premature ovarian insufficiency is very common. Early menopause is when women under the age of 45 have an early menopause. Premature ovarian insufficiency is under the age of 40. So it affects a lot of women, and a lot of women aren't getting the right treatment because they're not being diagnosed. When I was at medical school, I was always taught if a woman didn't have her periods, make sure they're not pregnant. Clearly you don't want to miss pregnancy in a woman, but otherwise don't worry about it. You worry about bleeding, but not about no bleeding. And that's so wrong, because we know 1 in 100 women under the age of 40 have an early menopause, and there are health risks. A lot of women tell me that they've seen a healthcare professional and been told they're too young to be menopausal, because we know the average age of the menopause is 51, but there are a lot of women who have an earlier menopause. So it's very important that if someone does have changing periods, they have symptoms, they consider that they might have an early menopause. Around 1 in 5 women with an early menopause don't have the classic symptoms, so the hot flushes, night sweats we all know associated with changing hormone levels, often women don't get. So some women just have the more psychological symptoms, so the low mood, anxiety, low motivation, reduced concentration. And so those women often are misdiagnosed as being depressed. They will have depressive symptoms, but it's because their hormones are low in their body. There's lots of really good sources of information out there. The Daisy Network is a really good charity that does phenomenal work helping people. Some of the cancer charities, if a woman's had cancer that's caused an early menopause, can be really helpful. We've got good guidelines out there. My website, menopausedoctor.co.uk, has all the guidelines there, but it also has some very easily accessible, downloadable information for women about menopause and treatments as well.